vitamin D deficient, which you corrected with, I needed a little more vitamin D, but also you have to take vitamin K in conjunction with it.
K2.
K2, because it helps with the absorption.
Right, it helps the absorption. It puts the calcium in your bone. So there's a specific protein that your liver makes, and it gets activated by vitamin K2. So menaquinone is K2. It causes the protein to wake up, it grabs the calcium and puts it in your bone. Because if you don't do that, what's going to happen?
When you get old.
Well, but your calcium starts to float around your body, all kinds of places.
Oh.
It probably doesn't need to go, like in your arteries of your heart, or in some glands, or like your breast tissue, or your prostate gland. And then all of a sudden we've got some abnormal calcifications where it shouldn't be. Unhealthy stuff. Sometimes this stuff can be precursors to things like cancer, like I said, with breast cancer and prostate cancer. But for heart disease, hypercalcemia is associated with increased risk of heart disease too. So you should always take your vitamin D3, which vitamin K2, that's the one that biologically activates the protein necessary, or carboxylates it rather, so it can take and put it in bone. And that along with the other treatments. So yeah, you learned that.
And you got me started on DHEA.
Mm-hmm.
What age should you start taking that?
So the way to answer that question is this. We assume, which is a terrible word to use, that people have normal hormone functions for pretty much most of their life until they've hit, some magical age, which is yet to be determined. Mm-hmm. Okay, so I think what we do is, if you're working in my field, when you're doing anti-aging regenerative medicine, I look at all your hormones. I should be looking for dihydroepiandrosterone, which is DHEA. I should be looking for the precursor pregnenolone. I should be looking for farther metabolites downstream, like testosterone, and if we're going to estrogen, because you're going to aromatize some of that testosterone estrogens. And so you should be looking at those things, and you should, based upon your patient's complaints and symptoms, maybe that should be part of your workup, looking at some of these hormones to see if there's a deficiency. Now, at a certain point, particularly like in a woman or female, you're going to see that the patient hits menopause, which means that they're not going to be having the hormone effect that they need anymore, and that's going to contribute to demineralization of their bone. And so you should be checking for some of these hormones to see if they're available, because they will help fortify and make the bone stronger. And so, depending on what a patient presents, fatigue, low energy, maybe chronic stress stays for a long time, they've developed something called adrenal fatigue maybe, and then along with that they've driven down their DHEA. It's more common to see some of these conditions in 30s and late 30s and beyond that. But once upon a time, I was thought you never checked people till like their 50s, 60s for these things, and maybe it wasn't even necessary to do so. But I think on many instances and many forms, you've heard that DHEA has been talked about as the youth hormone, because it is a signaling hormone, and you have receptors in your brain, in your bone, in your muscle, in your tissues for dihydroepiandrosterone that specifically have an effect on it, which helps in an anti-aging pattern, whether it's regenerative effects, rebuilding effects, but it has an effect along with the other ones that we use.
Okay. And another thing is, you were able to adjust my thyroid without changing my medication, but by simply giving me some multivitamins.
Right, how about that, huh?
Believe me, you have not ceased to amaze me. So I come back about every month, 6 weeks, and it's like, what are we going to do now? And I've only balked at one test. And I think what it was is the phlebotomist basically threw it in my face, and I'd been fasting, hadn't had my coffee, and she hands it to me, and she starts talking like a chipmunk, and I was like, so I called the office, do I really have to do this? Yes, you really have to do that. So, oh gosh, you're just a plethora of information. I just don't even know where to go from here. Tell us a little about some of the other services that you offer.
So, all right, let's see. So in this particular offering daily support, what we're talking about here is nutritional supplements that we offer, and some of them are for detox, some of them for energy, and people are asking, well, what's this for, Doc? What's this for that? Well, sometimes the answer is not like a one-sentence thing, but Now, I can touch base on them on some things, like NAD treatment is nicotinamide adenine dinucleotide. I go, what is that, doctor? That is a vitamin B3 analog. And fortunately, that particular vitamin or analog of that vitamin provides energy for some very important genes that are expressed into certain proteins, enzymes, that help repair damaged things like your DNA. So super important because long-term damage can be repaired if you have enough nutrition. That particular product can also help create what they call mitochondria. Mitochondria are the little motors in your cells that create energy, something called ATP. And so it's been shown that that particular vitamin can help you create more. What does that mean? Well, if you're losing them because the nutritional standards are going down and because you don't have enough NAD in your body because you can't make it anymore, because that's part of one of the signs of aging, if I can replace it and we can regenerate it, then that cell doesn't have to die and it doesn't have to replicate. And what does that mean? Well, our cells have a programmed replication half-life. Okay, it's called the Hayflick law. So we only have about 50 or 60 in us. Okay, and so after it replicates 56 times, the cell dies, and so that cell line will die, and eventually we die as a result of that, whether it's some catastrophic event or slow. But nonetheless, it happens. So if I can keep the cell alive, it doesn't have to replicate. It can extend its lifespan out. Therefore, I don't have to replicate as often, so I can live longer and healthier. So that's that particular part. But it does a lot of other things too. It's great for detox. It's great for withdrawals for patients who are having low energy states. And what do I mean by low energy states? People who are going through withdrawal from opiates, narcotics. You can give those to alcohol. You can give them high dosing of NAD, and you can basically completely push away any withdrawal symptoms patients go through. It's phenomenal.
Wow.
I also have used it for some other things, and it's just been fantastic. I can't complain. Energy, pain management, it's pretty amazing. So there's that. So that's a lot of information on that, right? And sublingual glutathione. So what is this particular product? Well, glutathione your liver makes. It's your detoxifying agent, period. That's the strongest antioxidant your body makes. Probably next to melatonin. Melatonin is a super antioxidant hormone. But this particular product has to get regenerated in your body. If you drink lots of alcohol, you take a lot of Tylenol or other products to affect your liver's function, you don't have as much glutathione. Why is that important? That's important because your body can, if you can regenerate or have more of it, then your body can use it to detoxify inflammatory components in your body and basically neutralize them. That's why it's key. We also got some vitamin C, which is antioxidant, also helps provide support for other things like glutathione, good for skin health, good for detoxifying neutralization agents, so it's fantastic for that. And then we have high quality full spectrum CBD oil. And people say, what is this all about, doctor? Well, I only carry like maybe 1 or 2 CBD products in the office. And I carry them based upon the literature that I read. This particular product that we carry is great because CBD has been shown to be anti-inflammatory, it can be anti-seizure, it can be a mood stabilizer for patients, it acts as a adaptogenic response for your body. People ask, what does that mean? Adaptogenic means that it can program or send signals into your cells. So it can be a cell signaling agent that tells your cell something to do different. And what does all that mean? It means that what our cells do, what they create, the byproduct, their communication, is dependent upon the information that comes in or that's signaled to it. You can change that, you can manipulate that. Okay, that's basically, and then the outcome of the cell, what it does, its product and what it does, what it makes, or what it stops making, or what it turns on and shuts off, can be directly related to a product like that. Pretty cool, huh?
Well, I've used CBD oil. I got some down at the Brass Unicorn, and that I was actually rubbing on the area that was bothering me. Okay, seemed to work really well. Then I went to a different place, and they gave me the type that you put under your tongue. I don't think I like that as well.
I think it just depends on the patient. If you like it, I think when you put it underneath your tongue, it goes in your bloodstream immediately, and it's more of a global response. And I think a lot of patients use it for like mood stabilizing, calming effect, sleep, that kind of stuff. And I think when you localize treatment, it's because you have pain.
Okay.
You have inflammation, pain, and that acts as a very good anti-inflammatory component and a pain reducer.
Okay. got me stumped now.
Well, but a lot of these things, people ask me, why do you take all these things? Well, most of these stuff you can do orally, but NAD we do IV. We do an IV treatment in the office also. So here's this oral sublingual, but we do have IV treatments.
Now that involves sticking a needle in you?
Correct. So we
They lost me there.
Well,
Now, this is what I can't figure out. I can go to the dermatologist, they can give me 5 shots in the same day and I don't squawk. But if I find out I'm getting a shot at the doctor, it's like...
well, you're going to really want it, and then
Yeah,
a lot of patients do research and they come to me and they do offer this treatment because they see all the benefits that they've read up on it. So, and we've adapted the office to be able to provide these treatments. And so we do NAD treatments IV. We do IV glutathione for detoxification of the liver rapidly. We do IV treatments of vitamin C. So you can do all things. And people always ask, well, how much do you give, doc? You know how you always take maybe 5,000 milligrams of vitamin C and you may have diarrhea, you might not. Well, we can give you 25,000 to 50,000 milligrams of vitamin C IV, and you won't have any of those side effects.
Wow.
Super antioxidant load, and just helps regulate and detoxify, gets rid of all the free radical oxygens that are rather free oxygen radicals are creating. You're like, why is that important? Because oxygen-free radicals are what kills us. They're what causes DNA damage over time, slowly, internally. That's the slow death. Okay, so if you can neutralize that stuff, that's where you have this longevity. You don't want to walk outside and get hit by a car, but my whole point is that, you want to look good, you want to feel good, you want to have energy, you want to be able to do anything you want to do, even compete at any age. And people ask me, well, doc, I'm 51 now. They ask you, do you compete? I'm on, no. Why not? I don't want to get hit in the face.
Right.
I want to keep my brain cells so I can do what I do, which is take care of people. But people see me, like you said, all the time at the gym. I'm very active, and I do a lot of resistance training because it's good for your brain, it's good for your heart, good for your muscles, your bone health. I'm also a very good, I don't know if it's good's a word, if that's the right word in this context, but I'm very flexible, let's say. I could always do the splits since I was like 15, and I could still do them. I just need to warm up a little bit.
Right.
It's not bad for a 250-pound, man at 51 years old. It takes me a little longer to get there, but I can get there, and I believe in flexibility. Flexibility is super important. Super important. If you're a martial artist, that is like the most important. To me, most important. Because if you teach flexibility to somebody or be super flexible, you can teach them almost anything in martial arts. Because there's nothing you can be limited in doing. Nothing. So, so I'm very big on being athletic and being very flexible, because that's one of the missed components in all of our exercise program. People don't spend enough time doing that.
Now, how often would you have to get one of these shots, these detox shots?
Well, it depends what you're doing. It's like, say, like I have patients that take chronic pain medications because they have chronic pain disorders and things like that, and sometimes they want to get pain relief. So I'll have some patients come in once every 2 weeks, and they'll do an IV of NAD, maybe 500 milligrams, take about an hour and a half to deliver it, and then they're good for 2 hours. They're good for like 2-3 weeks, maybe 4 weeks without pain, or a significant reduction in pain. Glutathione, you could do a glutathione push in about 15-20 seconds, and helps flush the liver, helps give you some regenerative glutathione, detoxification capacity. That's very quickly. Vitamin C, you can do that very quickly, but I find if you do it very quickly and don't dilute it enough, it can burn a little bit in the vein when you do that, even on a large bore vein. So I think that it can be delivered in about 10-15 minutes pretty quickly. You can deliver 25,000, even 50,000 milligrams.
Wow.
So it feels how often, vitamin C, like I have a cancer patient who would see me, and her oncologist is like in Irvine, California, but she lives up in Fresno area. So she would come, she referred her to me, so I would do her IV vitamin C treatment. So we would do it once a week. We would give her 50,000 milligrams IV to help with her treatment, because she had a soft tissue sarcoma cancer, and part of that treatment program was to be on that. And she did relatively well on that, and that worked really good for her. Just depends on the patient. Depends what the need is. That's why we do consultations to figure out what is in their best interest. If you have other collaborating doctors who have maybe referred the patient, I'll see what they're looking for, and then we'll kind of integrate into what we're trying to do.
Yeah, I've noticed in my own personal life how much the medical profession has changed, thank God, through the years. But my definition, or the difference between an MD and a DO, is basically when you get sick or hurt, you go to an MD and they fix that problem, and out the door you go. The DO, you go to a DO to stay healthy.
I ain't gonna argue.
I mean, like I say, I keep coming back because I don't like to be sick. It puts a crimp in my style. You know, there's nothing like planning for something and then getting sick and going, oh, I can't go.
Right.
So, wow, this is great. I'm going to have you on the show again because I'm going to have time to absorb all of this. But if somebody wanted you to be a ringside doctor for their event, do they contact you directly?
So on some occasions, some promoters have done that. Just been doing it for 20 years. So some will call specifically looking for some type of ringside doctor because maybe we've worked with them in the past, have a good relationship with them, and it just makes everything work smoothly. So they can call me sometimes, but what I usually tell them to do is call the athletic commission out there in Sacramento, California. Let them know the chief executive officer that you'd like to have Dr. Allende work in your event if he's available. And the commission. I sit on the advisory committee for the medical division of the state of California's athletic commission, so I help, give recommendations and guidelines for the athletic commission to present regulations and laws to the state. And so I'm always going to be accountable to a higher authority. So anything that I do, if they're requesting, it's just because they like me, and the experience. But they usually call the commission. The commission has no qualms about assigning me to an event if a particular organization wants me to work it.
So you grew up in the Bay Area, but what brought you to Fresno?
Well, my residency training in medicine brought me to Fresno. So I trained at UCSF in downtown Fresno's family medicine program. I was really a rotating internship at first with the idea that I was going to become a surgeon, and then I actually was accepted to a surgical program in Bakersfield, California, and because I had little children at the time, had lived here for 1 year, I was really concerned about getting up and moving again, and then not knowing if we were going to be moving again to continue the residency program. So I opted to come into a second-year program here in family medicine, and then I finished and completed that residency. And then after that, pursued some of the other subspecialty things that I were interested in, and I could do it at my own pace, because residency programs are based at their pace. And so you're always reeling, we'll call it reeling, You're working 102, 104-hour weeks at a time, and it's not definitely for those who aren't prepared for a challenge. And then after that, you can kind of make your own program decisions on how much more education you want and what you want to focus on. So that's how I got here. Then I was offered a position to stay here after I finished residency. I chose to stay, and I've been here ever since. Turns out Fresno, California is a pretty nice place to be.
It is.
Yeah, I didn't think that once upon a time because I grew up in the East Bay area, but the more I live here, I realized, boy, this is a really nice place to live. It gets hot. That's the only thing that stinks about it sometimes. It gets a little hot. I can live with that. Because there's some other things that I probably don't like about living in other places, and this is just about right. My kids like it, and my wife likes it, and that's all the most important things, right?
Right. Well, thank you so much for being on my show.
Thanks for having me. That's nice of you.
This is just great. And I hope that I can come back and we can do a little more on the medical side.
Anytime you want to. Anytime I come back, just let me know.
All right. Thank you.
Thank you.